Assalamu alaikum. This is a nice case of PVC ablation. Salah will start with the history.
I will start the history with the age of the patient. She is 58 years old. She has a high she has a high burden symptomatic PVCs. Years ago, she underwent multi-slice CT coronary angiography, which revealed normal coronaries. As we can appreciate from the resting ECG, RSR- in V1.
Now, okay, so this is a patient with high burden PVCs, very highly symptomatic with normal echo and the CT coronary normal. This is the 12-lead ECG of the patient. She was in Gemini. Anwar had surah al. She was running in Gemini, as you can see here, and we can appreciate localization of this access pathway. انت كنت هتقول يا صلاح قول كده. Localization of the access pathway.
The localization of ECG, our provisional diagnosis was LV summit because of R wave in V1 and RSR- in V1 and inferior axis with R waves in 2, 3 and AVF and QS AVL.
And AVL.
Yes, and the QS. Actually, the lead one is RS, it's biphasic, and AVL is completely negative. So we put a differential diagnosis, left coronary cusp versus LV summit. When we advanced the CS catheter to the distal CS.
First, Anwar went to map within the left coronary cusp, but we could not get good numbers. And there was still 10 millisecond earlier, 15 millisecond, which was not satisfactory. Above the cusp and just below the cusp.
Right coronary cusp and in the left coronary cusp and in the junction between the left and the right coronary cusp, the earliest signal was 11 milliseconds preceded the
هنكبر هنا شويه. Okay, so we انا بقى ايه I said okay, this is not a good number, so this is very not early, so I said push the coronary sinus into the summit, into high up, and Anwar was very intelligent to do this, as we'll show you on the fluoro, and he pushed it, and very nice signal when we got it that the CS1 and 2 فين هنا بقى CS اهي.
This is the CS.
Yeah. لما زقنا الCS
we push the CS in the anterior cardiac vein.
ايوه. So هات بقى سرعة أكبر. هات بقى هنا على الPVC نفسها. واو and spiky. Very juicy tension. Measure Anwar.
Okay.
More than 20.
Oh.
This is 27. Very good signal.
This is my target. What I did, طبعا we were doing this by Carto, and Khaled will show us the Carto. What I did, this is the technique, how we think. I said, okay, I'm going to go to the ventricle to target CS1 and 2. ودي هنشوفها على الفلورو دلوقتي. زي ايه بقى؟ This is exactly when you think about a left anterolateral accessory pathway. ليه؟ You have negative delta أو يعني as if same. I pushed the catheter into the ventricle لأن he kept this CS in this position. I liked it because this is the only site where the CS got us 22 well 29. So أنا بس خلاص أنا this is my target. What I did, I went with the catheter and I pushed it as if I want to go to the annulus. This tells us مين بقى أنا mapping going to كده. I went, oh, that was the signal. Compared to the CS, I'm earlier. Compared to the complex, I am 40 milliseconds. Okay, so and we'll show you on the fluoro. We ablated here immediately, but we used very high watt. During ablation, the observer هنا اللي كان قاعد كان توفيق, he said it's segment depression because we are using 50 watt in this area. We did coronary angio, I show you, and this PVC completely disappeared. We gave booster dose. Anwar gave a booster dose at 40 watt. We observed the signal, segment depression, no segment depression, and we shooted the coronary, which is mandatory. Okay, very good. Here, اهي. We have been waiting since 29 minutes 53 seconds, and we'll go to the carto to show you, and I will show you the fluoro first. We can see this is the right anterior oblique view. We use the long sheath in the left side so that because of tortuosity, we can see that I'm under the annulus. I'm in the summit, and you can see that the CS is going into the anterior cardiac vein. When لو بصينا الناحية التانية look at the LEO view. This is, I got this signal from below. This is in the summit. What we did, because we saw this segment depression, we shooted the coronaries. ورينا بقى coronaries. We shooted the coronary from the other side. In order to compare the site of the catheter, we are not far away from the circ. مش ده السيرك الصغنن ده؟
Yes.
We were not, يعني we are very close, and because of this but alhamdulillah, no spasm, no obstruction, nothing. As you can see that the CS catheter is going into the
Real summit.
Yeah, very nice signal. Now we'll go to the carto. First, in the carto we get this template, and very important to do template match. If you get the same PVC, you have to compare it with the template, because sometimes you get non-clinical PVCs, catheter induced, and even if you get catheter induced and you got it the same, so you are very close to the area, like pace mapping. We don't do pace mapping. So show us Khalid في الأول. In the beginning, we were mapping in the cusps of the coronary cusp. This is the first point.
Yes.
We were mapping here. We did not make a shell, but we were mapping here. That was above the coronary.
Yes.
Left coronary cusp.
In the left coronary cusp.
And this is the non-coronary cusp, and this is the right coronary cusp.
Okay, Anwar will explain to us the anatomy. He's very good in anatomy. يلا يا
Okay.
أنور.
Okay.
كويس. ماشي.
And this is the junction
Okay.
between the right coronary cusp and left coronary cusp.
The right coronary cusp is the most anterior, the left coronary cusp the most posterior, and the left coronary cusp is on the left side little bit.
Here, the early signal above the cusp.
Okay, above the cusp but was 15 milliseconds, was
15.
not
Yes.
satisfactory.
Yes. ادينا
11 عندك كانت 15 عندنا. ماشي.
ادينا
فين البقى successful side؟
البوينت اوف لحظه واحده. فين الليفت لاترال؟ اوكي ده above
The cusp.
the cusp. This is below the cusp.
This is when I went into the left ventricle وengaged the catheter والCS. ما انت ما وريتناش الCS عندك هنا. No problem. So, and this is the point of minus 40 milliseconds before the cure is complete. That was
قيس المسافه من هنا لحد هنا قد ايه؟
احنا ما علمناش الليفت مين.
ممكن
not give a mark to the left مين.
ممكن نقيسهم.
قيس المسافه دي was not far, but this is the summit. As you can see here, running ECG, no recurrence, so about 30 minutes. Yeah, 17 millimeter. not far يعني سنتي وحاجه، بس انت جيت له من حته محشوره فيها.
واللي تحت الكورونيك كاسب مور يعني هي اقرب للصمت
طبعا. بس that was a summit PVC.
Very nice.
We used the carto, we used the conventional. بص هنا خالد، بص هنا. And also we did the coronary angiogram to make sure that this segment depression is not indicating any obstruction or thrombus. If there is something, we can do intervention immediately. But alhamdulillah, was only heat transmission. وكده. That was perfect. Now here, look at the ECG running now. This is 34 minutes. End of study!